Oh, Ashley, I'm so proud of you.
Good morning. Welcome to Climate Health Now's August meeting, community meeting. We have a really awesome lineup, so I'm glad you're here.
Yeah.
So I'm going to start by sharing my screen, and let's see. Okay, it's been quite a week, so I'm glad we're gathering to do a little processing. So this is the overview of what we will cover in the next 90 minutes. So starting out with a welcome, and I don't know who among us knew Dr. Paul Auerbach, but he passed last month. And so Jonathan Liu is gonna speak to that loss and just kind of honor his life. Then Bryce is here with us, and Gail will discuss the Catalyst Collective and their particular project in the Central Valley, which we couldn't be more excited about.
Yeah.
And we're going to break out into hubs for 10 minutes together and then 5 minutes reviewing the ideas that come out of it. We will review from Supervisor Chavez's point of view, what helped the BACMED Rule 6.5 vote go from kind of, narrow margins to a landslide, and how we can carry forward the lessons from that to our future work. Then we're going to hear from our Vote for Health team. Margie and Cynthia will help us know how we as health professionals can help heal democracy in order to address the climate crisis ahead of us. And then we're going to hear, like I mentioned, from Nathan Uchtman about what our role can be in COP26 and what it is and why it's so important. And I'll wrap up calling for some help with specific meetings around AB 713, the bill that we are co-sponsoring, which is the health equity impacts of climate action. And then we'll hear the sustainable energy team updates, and then we'll wrap up. So that's the road ahead. So a big thank you to Karina, who is going to be interrupting vocally. So for each section, when there's 1 minute remaining, Karina is gonna just say 1 minute so that we know that that's the time to wrap up for that section. And we have so many different things. It's really important for everybody to share the space. I don't really have a note taker identified yet.
I can be the note taker, Ashley.
Oh, wonderful!
Yes.
Yay! And I think I got the text stuff down, and we're gonna skip the norms for this month. So just always regrounding in what our mission is, which is that we are a group of doctors and health professionals in California who recognize climate change as the public health and equity emergency of our lifetimes. So we organize and mobilize the trusted voice of health professionals to advocate for a rapid, just transition off harmful fossil fuels toward a healthy, equitable society sustained by renewable energy. And I didn't really know where to put this, but it's been I feel like we say this all the time because it's always true, but with the UN, the IPCC report this week, I wanted to just share, and we'll put this in our newsletter, but there was a really, really helpful list of resources for how to navigate in a positive way all the emotions that come out of this work. So it's through the All We Can Save project, which I couldn't think more highly of, and we'll share this resource list. I think there's some really great tools on there for just how we keep our heart from, backing away from how hard all this is, and really keep our work centered in why we're doing this. So CHN is really nurturing our 7 hubs the latter half of this year, especially. COVID has made it hard, but we have 7 hubs across this great golden state. We have the North State Capital Corridor, which is enormous and is everything kind of north of Marin, Contra Costa. So this huge outline here is North State Capital Corridor. And then we have the tiny, dense Golden Gate, which is Marin and SF counties. And we have Peninsula and South Bay, which is the San Mateo County, Santa Clara, and Santa Cruz counties. East Bay is a hotbed of climate health activism, and that's Contra Costa and Alameda. And then Central is also really large, which we'll hear from Rice and Gail, who are joining us from our Central hub. They live in the Fresno area. So this is our Central hub. And then we have Mid SoCal, which is kind of, 7 or so different counties. And then our southernmost contingent is ORISD is what we call it. So Orange County, Riverside, San Diego, and Imperial. So that within the broader CHN umbrella, these are the smaller regional communities that we're really investing in the years ahead, and we'll hear more from. So at this point, I'd love to stop, and if we have somebody who this is your first community meeting, we'd love you to share your name, your practice or specialty, where you live, and then just literally one sentence about what called you here. We'd love to meet you. So any new participants? I don't know if you're new, but Katie, I don't know if you've ever introduced yourself broadly.
And race or right?
Hi there, can you hear me?
Mhm. Yeah.
Hi, yeah. So I am a radiation oncology resident at UCSF. So currently up in the Bay Area. And very interested in looking at the climate impact of oncology care and how to start implementing sustainable practice. So currently we'll be working this year as a climate health fellow at UCSF, looking at some metering of diagnostic and therapeutic machines. So just looking to connect with a network and, several people had mentioned this, so just joining today.
Great. That's
Welcome.
wonderful. Yeah, thank you. And then let's see. We're definitely going to hear from Rice shortly, so maybe we'll wait for your section. Anybody else? I saw Nancy.
Hi.
Nancy.
Yeah. Hi, I'll jump in. Yeah, it's Nancy Zinn, and I'm a retired nurse practitioner in the Bay Area. I live in Albany, California, of course, which is, for those in Southern California, it's right next to Berkeley. And I've been very interested. I'm not sure how I fit into this organization, so I'm really happy to be here. And what called me to join this group is Amanda's editorial in the Chronicle about the refinery. And I was inspired to know there was this group. So I'm here, and I'm going to see where I fit in.
Wonderful.
Thanks.
Thank you, Nancy.
Happy to welcome you in. And then I see Mark's phone. Is that Mark Kudernick or a new Mark?
Hi, it's Mark Kudernick, same old Mark.
Great. Glad you're here.
Same old, great old, Mark.
Same old, great old, exactly.
Yay. Cool. Yeah, I think anybody else new?
How about Nishanga Bliss? Have you ever introduced yourself?
Hi, very long ago, maybe at one of the inaugural meetings of this group, like back when it was in person. But I'm Nishanga Bliss. I live in Berkeley. I'm a licensed acupuncturist. I teach at the Acupuncture and Integrative Medicine College. And before the pandemic, I was doing acupuncture at Children's Hospital Oakland. And just, yes, I'm an educator, and so I've been just working with climate curriculum with my students, but I'm always looking to share resources on that and develop that work. And yeah, I'm grateful to all of you and the amazing work that this group has been doing.
Yay. Great. Glad to have you back. Save for Eve, it's been a while, so we're glad to have you here. So, going back, so if you don't already receive emails here and there from your hub, we have a membership form. That's how we help you, find your local colleagues. So maybe Amanda, if you could drop that into the chat. So if you haven't already done this form, or you don't know, who's in your hub, then if you do that, then that'll help us to connect you into your hub. So I'm going to pass it to Jonathan. When I saw this picture of Paul in Haiti, it just finally made me feel this loss. So Jonathan, if you want to share about Dr. Auerbach, that'd be great.
Hi everyone, my name is Jonathan. I use he, him pronouns. I'm third year medicine at Stanford. Yeah, so I'm part of a student group at Stanford called Stanford Climate and Health. And when we kind of first were getting started after the youth climate strikes in 2019, Dr. Auerbach was one of our very first faculty mentors. And so that's one of many ways that he has touched many people in the Stanford community. He was also like a leader in the emergency medicine department. He kind of like started the wilderness medicine like specialty in emergency medicine. I remember like back in December 2019 for like some winter break reading, a few of my classmates were like, we should read Enviromedics, which is one of the few. It was a book that he wrote about climate change, kind of like summarizing the science and its impact on health. And then like the next month when we were having like our informal first like meeting of medical trainees, just who cared about climate change in like a little cafe at like 6 p.m. on a Monday. He just like showed up in like a plaid shirt and jeans and was just like, is this where the climate meeting is happening? And we were all kind of like taken aback. But it seems like this was kind of the person that he kind of continued to be throughout his life. Even though he has accomplished some very amazing things, he continued to be very down to earth and just try to see how he could be helpful. Yeah, I think like this, yeah, again, like I wish I could say more about his entire life, but I've only known him in this capacity, and in this capacity, helping our community develop like movements for sustainable healthcare within Stanford. We didn't have like an emissions goal like the UC system or Kaiser. We did not have an emissions goal back in like April or May of 2020, and it was a whole kind of movement and advocacy building process, so that like now I don't know if they've announced it yet, but like we're pretty sure a goal is going to be announced soon, and that is kind of the culmination of a year and a half of coalition building that Dr. Auerbach helped advise us. But yeah, even when we found out about when we found out about the tumor in June of 2020, he still tried to, he's like made up of a lot of things. He still tried to be involved, responding to our emails, which not a lot of people do. So like we know how it is, but I think it's yeah, I think this is pretty devastating, and I think I guess like I would just hope that I think like with this kind of community and this kind of work, it's very important to stick together, and I think like it takes a lot of I think we are just like very lucky to be surrounded by each other and be able to work with each other. So I hope that we can continue to appreciate each other and stay down to earth in the way that he continued.
Totally. Thank you, Jonathan. I met him a couple of times, and the last conversation I had with him, he was kind of like a mentor role to me of, you know, how do you accomplish things in medicine, which can be very conservative. And he was just really encouraging and, you know, a very visionary mentor. So yeah, a loss. Climate Health Now will miss him along with many others. And we just want to honor that. So I did get to interview him. I think it was about last year. So I have a podcast interview with him if anybody's interested.
Okay.
So thank you, Jonathan. Appreciate that. And
Ashley, if you could make that podcast available, I think.
Yeah.
And in some enduring way.
I will share it in our newsletter. And it's saved. So thank you, Jonathan. So we're gonna turn now to our some of our Fresno colleagues. So I'd love to introduce Dr. Rice Bora and Dr. Gail Kuklis to share about what you're planning on organizing around during the Catalyst Collective, which you're one of 24 members doing that. So I'll turn it over to the two of you.
Thank you. Thanks, everyone. I'm Race Bora, and I think Gail is on also. And wouldn't you know it, in 2010, I had the opportunity to go to Haiti to help with that earthquake response. And my first day there was Dr. Auerbach's last day there. And so that's
Whoa.
where I got to meet him, and total badass. I mean, all I have to say is you were in the presence of greatness, and he obviously commanded our field hospital that was set up out in a tent outside of the hospital, which was devastated, which is probably what that picture was. Just the whole Stanford crew just really took us under their wing and really taught us, here's what you need to do, and here's how you very humbly have to approach this very massive, complex disaster. And so it was very inspiring to get to meet him. And later, I did work in Nepal, where he had also done a lot of EMS work. So it's amazing, there's so few people in our careers that really cast such a great footprint and such a long shadow. And he indeed is just a giant in our field of emergency medicine and wilderness medicine. So thank you for commemorating that. And thank you, Jonathan, for your amazing remembrance of him. I think all of us who knew him are lucky to have known him. And we are all still benefiting from all of the different ways that he advanced the field.
Amazing overlap. So yeah, do you and Gail want to share about the C6 collaborative?
I will,
vision?
yeah. So, I'm an ER doctor. I'm also a toxicologist. I'm the medical director at Poison Control, which is one of our divisions is, it's a statewide system, but one of our divisions is in Madera. And then more recently, I've gotten involved in public health. And so I'm the interim health officer for Fresno County. And I've been lucky and privileged to have Gail. Gail is one of our EM residents, and she has done more work during her residency than I've done in my whole career around climate change and climate health. So I really see her and some of the other residents who are so motivated in this space as really future leaders and rising stars. But more recently, what we've done is created this really just a work group. And it really comes on the heels of observations, which I feel like I'm preaching to the choir, because I feel like I don't have any formal training in climate, but if you go to the next slide, you can sort of see the stories are just coming fast and furious now, just in the lay press. I don't even have the bandwidth or the time to dive into some of the scientific literature, although I look forward to that. But basically, the writing is on the wall, and it's so apparent that the climate crisis, like the current coronavirus pandemic, is going to really affect vulnerable populations quite a bit. So from my perspective at public health and in emergency medicine, I really feel like we need to be as proactive as we can to help really plan and mitigate some of the disasters to come, because I feel like our region, which is relatively under-resourced to begin with, we have very few medical providers, we have very few hospitals compared to the population size and need, that any disaster just threatens to collapse our healthcare system, which unfortunately with this surge of COVID, we're experiencing that now just with COVID, but hopefully that will be temporary. I wish I could say the same for climate, but as you all know, this is going to be decades long unfolding. So we're just trying to prepare for it as much as we can. If you go to the next slide. So what we decided to do was to create a work group. So this is basically an example of the kinds of information that, our health department actually captures, things like the temperature cycles and then the number of ED visits. And so this is just the kind of information that, I can use to teach our community to say, look, as our temperatures go up, there's a big spike in our ED visits related to heat. And so that's basically what you're seeing there with the black lines. Again, should not be news to anyone on this audience, but this is just the kind of information that we're starting to capture. We need to do much more with this kind of surveillance, but just one example of how things look in Fresno. Go to the next slide. So what we did was we decided to create a work group to really address some of the health risks associated with climate change. You may be aware, the New England Journal is actually putting out some great review articles just for someone like myself who, is interested, but certainly considers myself a novice in this field, just about the different exposure pathways. If you go to the next slide, the exposure pathways then lead to organ system dysfunction and really just different health outcomes. And to be honest, this feels like somebody came to Fresno and just mapped out like everything that's wrong in Fresno's public health. I mean, basically like these are all the problems that we're already dealing with now. And I'm not being hyperbolic. I mean, we have mosquitoes here that actually have been discovered to have dengue. We've got West Nile virus. We've got different spirochetes related to tick diseases, et cetera. And then everything else that you see on this slide are things that we are actually actively trying to deal with. We've got harmful algal blooms. I'm sure some of your counties have them as well. But as a toxicologist, that's like a really cool and kind of scary dimension to climate health, is that, basically all of our freshwater supplies are threatened by these, by these climate related blooms and things like that. So this is what I just began to observe. And so I just said, these are the kinds of things that public health should really start to proactively plan around. And so let's see what we can do about that. And that's the work group that we came up with. We're calling it C6. And let me let Gail take over and just describe a little bit of the vision that we're trying to form and where we'd like to go with that. So I don't know if Gail, are you at a point where you can talk a little bit?
In 1 or 2 minutes, if possible.
Yeah.
Okay, yeah, sure.
So basically the goal of C6 is to bring together clinicians kind of in all different aspects to both educate ourselves and the community, but then also actually have some actionable things. The first thing that we're looking at doing is a vulnerability assessment of Fresno County because that hasn't been done before. And as Dr. Vora was saying, there are many things that are quite vulnerable here. So this is really in its infancy, and we're kind of at the point where we're trying to find the people who are gonna bring this together and make things actionable. And this is kind of the Catalyst project that Ashley was talking about. This is our Catalyst project. So we're trying to build together our teams and really figure out a good framework for how we can take the really, from a scientific perspective, like really interesting place that is the Central Valley, but then actually do something to help people who live here because we're already seeing a lot of the effects of climate. So that's kind of a really brief synopsis. I wanted to see if anyone had any questions about anything for either Dr. or I.
Well, what I love about living here is that it's a small enough community to where everyone kind of knows each other. So even though this looks like a long and complicated list of people that we want to unite, we actually already have this network. I mean, we all work together on different issues. Obviously with COVID, it's forced us to really bring all the stakeholders to a common forum. And I think at Public Health, we've been able to do that. But then also, just over other issues just that are related and tangential, but will be exacerbated, such as social determinants of health, and even things like substance use disorders, which I'm very involved in my work as a toxicologist. We do try to bring together a broad base of stakeholders. So that's why I feel optimistic that we'll be able to make hopefully rapid progress in this space. But again, to do it deliberately, organically, and efficiently will require coaching and guidance. And so that's really what I'm hoping to get out of the Catalyst Collective, is to make sure that, that I have a good network there that will allow us to grow C6. And I said to grow it with fierce compassion. So that's my hope, and I'm really excited about it. And I just want to thank you for letting us just share a little bit about it at this meeting.
Yeah, we couldn't be more excited. And I think I've already, some of our Climate Health Now members in the Fresno area, I've mentioned it to a couple and they're like, oh, wow, I want to, how can I help? Which I think.
Yeah, that's what we've gotten the same feedback. So we're really excited that we're on the cusp of growing very quickly, and we want to do it, we want to do right by everyone that wants to be involved.
Wonderful. Great. So we're gonna.
Can I just say, Ross, this is Robin Cooper. I put in the chat a informatic for patients that's translated to Spanish. It might be something that you could use. So check that out in the chat. And if you want, connect with me about using that in the Central Valley.
Thank you, Robin. Okay, great. I'll check it out.
Oh. So we're going to spend, okay, how long do we have? So we have until 9:05, spacious 9 minutes. So we're going to break into hubs at this point. So let me see. So if you're in Capital Corridor or North State, you'll be in breakout 1. Amanda, if you could help, I've already pre-made them.
Oh yeah, they're made. Do you want me to open them?
Yeah. So if you're in Golden Gate, you're in hub or breakout 2. East Bay will go to room 3. Peninsula South Bay will be in room 4. Central, which is Santa Cruz, Fresno, will be in room 5. And then Mid SoCal 6 and Orisdi 7. So in the breakouts, we'd love, just to briefly again introduce yourself and then to share ideas about 1 or 2 locally relevant climate justice initiatives that you're aware of in your area, and what the local environmental groups, environmental justice groups are in your area, just to start kind of sharing that information. Then we're going to come back at 9:03.
And I'm going to start putting people in. If I know your hub, I'm going to assign you there. But if you can also message me if you're having trouble joining, and I can put you in your hub.
Yeah. And Amanda Foote, I know you have many homes. I don't know, maybe you could just choose which one feels right for you. And yeah. So, oh, these are not.
And Cindy, I know you're here as a guest, but I'm going to put you in the Peninsula group. Is that all right? I don't know if she's here.
Yes.
Okay.
This is Rachel. I'm in the car, and if someone could put me in the Peninsula group, that would be fantastic.
I will do it. Yeah, please speak up for anyone. I know a bunch of people are in transit. You can just speak up and I'll put you where you need to go.
Can you put me in a group? This is David.
Oh yeah, David, where do you live?
I live in SAC.
Okay.
Capital Corridor.
Yeah, perfect.
Thank you.
Okay.
Hi, Amanda. This is the other Amanda.
Hi,
for
other
today, Amanda. For today, do you mind adding me to the East Bay group?
Sure.
Thank you.
Yeah. Oh, for some reason, Amanda, I can't. Let's see. Oh, maybe
we put ourselves in, or
yeah, you can put yourselves in. Absolutely. Yeah, if you can, that would be great. I'm just trying to put.
I've never put myself in a breakout group.
Oh, okay. Is there something that says join group? Like, do you see, if you hit breakout rooms, do you see an option?
I don't have a breakout room option.
Oh, okay. Trisha, where do you?
California, Los Angeles.
Los Angeles. Okay, I will put you there.
Thank you.
Yeah.
No.
Buck Struler, where are you from?
He's San Francisco.
San Francisco. Okay.
And I don't see my name up there.
I know. I don't either.
That's all right.
The people who
Don't
to
worry
my
about it.
eye are unassigned are Mary Lee. Where do you go? Where are you from?
I just put myself. Yeah, I just put I put in the chat.
Are you the LA area?
Yes.
Okay, I'm gonna put you there. Okay.
Thank you.
And Mike Martin, welcome. Where, Mike, are you East Bay or San Francisco?
San Francisco.
San Francisco, okay. And then Hope, do you want to go? Do you want to go to the peninsula? That's where we put Cindy. Okay.
Thank you.
Yeah. Okay. So I'm not exactly sure, Cynthia, why we're still
I think there's
here.
something screwed up that it thinks I'm,
does it think
I think
you're...
because I started to form breakout rooms earlier, it thinks
Oh.
I'm the decider. So there's a mix up. It's all right. It doesn't matter.
Okay.
Don't worry. Join your group and I'm just going to relax for a minute.
Okay.
What about Nathan? Nathan's here. Does he need to get assigned somewhere?
Nathan, it looks, can you join? I think I put you in
Yeah, I
your
was.
central, but I don't, it looks like it says that you need to join.
Right. And
I
Bonnie,
was
you need
the
to.
only one there, so I.
Oh, okay.
Oh, you came back? Hi.
Do you want me to, Nathan, I can come join. You want me to join you? Because I'm East Bay, but there's a lot of East Bay people.
Sure.
Okay.
Hey, Amanda, I have a quick question.
Oh, yeah.
Before you
Yeah.
go, that's why I'm hanging out. I'm
Oh,
sorry.
yeah.
You know,
yeah.
I put in the chat, can we get a copy of his slides?
Oh, sure. Yeah. Of racist, I don't know if it's Reese or race. Yeah, I think so. We absolutely.
Yeah, those were really the health effects of
Yeah.
Yeah. Okay. That was my only question. I had put it in
Yeah.
the chat, but nobody said anything. So
Okay. Yeah.
I'll
I
go
think
for my
that should be
slides.
doable. Yeah.
Thank you.
Yeah.
Bye.
Okay.
What
I'm gonna-
about Adrian? It says she's unassigned.
I have put her in her, I think she maybe has joined, she's on I think she's on 2 devices.
Okay. And then
But I'm gonna
Vanessa's
go,
asking for help.
do you want to join, can you join Orisdi?
I can't do anything. I don't know what is happening. So I'm just not even going to try.
Okay, I'm gonna join
Vanessa's
Central.
asking for help in Orisdi too.
Okay, let me join Orisdi and see.
Hey, Adrian. Do you want to say hello if we're both back in the main room? Oh. Oh, everyone's coming back. Welcome back.
That was quick. Welcome back, everybody. We're all back together in the main room. Thank you for that. I hope you got to connect to somebody new in your hub region. So now we're going to turn it to Supervisor Chavez, to Board Chair Chavez, and we're really, really honored that you're joining us. And we are excited to take notes. If everybody can mute yourself, that'd be great. To take notes on, from your perspective as the chairwoman of the board, how did the Rule 6.5 issue go from kind of a, margin vote to a landslide, and really with an eye towards what can we learn and to carry forward on future community organizing? So thank you so much for joining.
Well, I'm really excited to be with you, and Hope Cahan in my office is with me also. I don't know where Hope is, but there she is. So, so Hope, you can jump in if I miss anything. And one thing I know I'm really with a lot of busy people who are doing everything they can to improve the health and safety of the people who live in our community. So thank you all very much for your work, and I appreciate getting a few minutes to spend time with you. I think, I was going to talk just a little bit about the background of the Air District, but I'm going to assume you know all that. And I think what you really want to talk about a little bit more is how do you take an issue that's complex, has a lot of competing interests, and push it over the finish line. So let me just say what I think worked in this instance, and how I think we need to think about these issues in the long term. I think that the probably the most important thing that happened was that the Air District had a very long process that led to this debate. And what happened was that in committee, this was discussed, everybody was invited to participate. The chair of that committee, John Bowders, did an exceptional job of getting people to weigh in and really walking them through a process. And they gave every opportunity to the refineries to say, we can do this, or we can do this. And essentially what they said was, and not only did they say, but then when they finally got serious, when I and other folks met with them and said, look, you're going to sue us anyway. So let's just get to the brass tacks. Tell us what you can do, and don't obfuscate, don't lie, just tell us what's possible. And still they didn't do it. And as Chevron in particular decided to kind of snub its nose at the process. So that was one thing that created a path, because we had a very public process. Everybody had an opportunity to weigh in. They got an extra opportunity to weigh in. When one board member asked if we could have one more hearing, we added the hearing in. As you all know, the hearing took 2 days and we let everybody speak. So I think my first message is creating an open environment where everybody has a fair opportunity to weigh in. The second is that the advocates for the health reform, as I will call it, for Rule 6.5, for the most part, were not anti-workers who were fighting for their jobs. And in the past, what I'd seen was this people coming at it like, you're getting paid to be here and I'm not, and I'm more righteous than you are. And all that self-righteousness, for 90% of the self-righteousness on behalf of the environmental community was gone. There was compassion, empathy, and understanding. And so and I would say a majority of the Air District Board are very sensitive to the labor movement and to workers' rights. I came out of the labor movement. I was the head of the South Bay Labor Council in my community. And so the vote could have been seen as antithetical. I didn't think it was, because, well, for a lot of different reasons. That's kind of not important for what you're doing. But the first thing was not creating that that fight where there didn't need to be one. And then lastly, I think we're in a moment that we have a window of opportunity to really change hearts and minds. I think while we have wildfires in the background and heat waves and extreme weather, and people are really in our community starting to understand the urgency of climate change, we're going to have a window to walk through making the changes that we need to make to improve the community. You all play a very unique role. And your role, because because you come from the health field, you have more credibility than most people on most topics. So as an example, the County of Santa Clara is going to be considering whether or not we try to close a regional airport next Tuesday. And we have a lead study that shows that children that live proximate to that airport have elevated blood lead levels. And we have a study that shows that it is because of the regional airport. And it was done by Dr. Sammy Zaran, who did the studies in Flint, Michigan. So what we did is we're using a scientific study that we paid for, but we didn't tell them what to do on it because it had to be, peer reviewed and all of that. And at our first press conference, we had the head of pediatrics for Valley Medical Center be one of the speakers, because he's not me, a politician. He's not a neighborhood leader that's annoyed with the noise. He's there to say any lead in children's blood is unacceptable. And we now know that this airport is poisoning children that live under the takeoff and pathway. So my point there is that if you all stay in your lane, and it's really important to maintain credibility, which is not to, I mean, you have a different kind of authority, right? You have persuasion, you have moral authority, and when you handle that without getting out of your lane, it makes you even 10 times more credible. And credibility doesn't necessarily build power, but it can.
Yeah.
I'm sorry, can you repeat what doesn't necessarily build power? That was cut off.
Yeah, credibility doesn't equate to power necessarily, but when you have other partners, right? You're one partner where you have many partners, that you build, you help build on that.
Yeah, absolutely. That is really, really meaningful coming from you, in your position, from your perspective. And I think our sense is that, but to hear it so clearly, reiterated from somebody in your position, it really means a lot. And the building power, that's what Climate Health Now is all about. So, Amanda, you want a question?
Oh, sorry. Is there time for questions? I don't know.
Yeah, we can take like two. Mm-hmm.
Okay. My question, Cindy, to you is, how do you think we could build a partnership not with the refinery corporations? Obviously, we're not going to attempt to do that or want to do that necessarily, but do you think we could find more alliances with the workers themselves? Like, do you see potential there, and what would be your advice to us on how to do that?
I think one of the first things to do is to go introduce yourself, and we can make this connection with the head of the building trades and have a conversation with him about how to do that. And one direction, I don't know if any of you were at the end of the meeting, you'll hear that the direction I gave to our staff was to figure out a process to engage workers of any industries in advance. So we're not dealing just with the industry, the corporations. And I think by reaching out to him and letting him know that you are going to have his back, that you work with him on a just economy, and that he can unleash you, like you will get 10 speakers or 10 letters or whatever when just economy issues come forward, and that you're going to stand with him and you demonstrate that. That's how you build kind of these working relationships. By the way, we Hope put in the chat the issue that we're dealing with. So if you want to write a letter and scold my colleagues about no lead, I would totally appreciate it.
We've got your back too. So
by when would that be due?
The meeting is August, it's next Tuesday. Tonight we have 2 hearings. I mean, tonight and tomorrow night, just on the study itself from 6 to 7. This researcher is brilliant. You all will understand him. I had to listen to him twice before I understood it. I was kicking myself for not doing better in science in school. So there you go.
We can write a letter, but it sounds like by next Tuesday. Is that okay?
And Hope can work with you, Amanda. Thank you so much.
Yeah. And we will engage our South Bay hub to participate too. And I think one more question, and we would welcome meeting with the workers. Absolutely. Our patients.
I'll take responsibility for making that connection.
That would be fantastic. One more question, and then we'll let Supervisor Board Woman Chavez head to her next activity. Bonnie, I believe.
Yes, thank you, Supervisor Chavez, for all the work you've done. It's amazing. I just want to ask, so if this is happening at your regional airport, what makes us think that it doesn't happen at all regional airports? So what is there something that distinguishes your airport from, say, the Napa regional airport?
Well, you are a smart woman, and that's the excellent question. So here's the facts. In our airport, Reed Hillview Airport, within 1.5 miles of that airport, we have 52,000 people who live there. In the other regional airport in our community, we have less than 2,000 that live within that 1.5 mile radius. So my recommendation is going to be that we publish the study, that we go through the process of making sure that it goes from a gray study to, publication, that we share the study nationally, and that we use that to do studies of every airport, because as you know, prevailing wind, proximity, all of that will play into, the significance of the risk, although there's 0 lead tolerance, but I mean, how close people live and whether or not you can attribute it to the airport. Bottom line is every airport in the country should get this study, and it should force, because the reason I want to make this public and we're just going to duke it out is because we want to force the FAA and the EPA to force unleaded fuel. We've had unleaded fuel in cars, since the early 70s. It didn't become a mandate in this country until 1996, which is madness. But aircraft were not, piston engine aircraft and other aircraft that use leaded fuel were left out. They were literally not included. So this is our opportunity to take a big bat, lean in, and help a lot of people. 4 million people around the country live close to airports. 4 million. At least 25% of them children, and they're low income, right? This isn't happening, and I would say this is probably true for 90% of them. In our community, it's almost all low income, and primarily Latino, African American, and Asian communities live in this area. Mostly Latino, Asian, and then African American. So we'll need your help, because we're going to make this a national movement.
Mm-hmm. Yeah, we couldn't see the value more. We should have a 0 tolerance for lead and PM. Really, that's where we're headed, right? So right. Thank you so much for joining. We're with you on the amicus brief for 6.5, whatever it is, but we really want to strengthen this as a partnership. So thank you.
Well, I look forward to working with you. Change the world, and I'll make the connections and look forward to your letter.
Yeah, okay. We love that. Yeah. Thank you.
Bye.
Wonderful.
And we're 5 minutes behind.
Okay, thank you. So we're going to turn over to the voting for health, and since it'll be 9:20 to 9:35, or if you could shave it to like 9:33, that'd be really helpful.
Yeah. Thank you. So can we have the next slide? And can everyone hear me? Can everyone hear me?
Yeah,
okay.
We can hear you.
So good morning, everyone. I think we all know that democracy is under attack. We covered the top 3 last time, that we need to strengthen and defend democracy for health. And that's so true for climate action, that the IPCC report has just hit with a baseball bat, as we said, or a bomb. So what are we doing? We sent a letter to all US senators talking about the need to strengthen democracy. We're preparing a compilation video that's an abridged version of that. And we're working to pressure Senator Feinstein with meetings. And we actually have a live action coming up next week. So watch for the announcement about that. And I hope many of you in San Francisco can attend. It's Wednesday, August 18th at 10 o'clock at Senator Feinstein's office. Then we're going to be moving into registration, working with Vote ER and getting out the vote about important local elections. Next slide. So we wrote this letter to all US senators. The health of humanity depends on healing democracy. The sign-on letter so far has garnered over 400 signers from 46 states. Our goal is to get 500 from all 50 states. So I would really ask for help. Bonnie, can you tell a little bit about how you got more people to sign on?
Sure.
And Karina, will you put the sign-on link in the chat for us, please?
Done.
Yeah, sure. I went through my contacts and looked for all the healthcare and physicians that I know and wrote just one email to all of them and sent it out, and with the link to the Google Doc, which tells about the letter and has the link to the letter. And I was surprised that I got over maybe close to 10 people who actually signed the letter. I never really heard back from anyone. And I thought, oh boy, did they really get it or do anything? But when I went to see the signers, I saw those names on the signatures. So is that easy to get that many people to sign up? And I just want to say how important, it never really dawned on me how important voting is as a health indicator, as now I really get it, that if we can't vote for people who protect our health, then our health is direly affected. And I just wanted to restate that, but thank you so much. Hopefully you guys will get involved.
So voting is a social determinant of health. That's the key thing. So we have these states, so Kansas, Mississippi, North Dakota, and Oklahoma. So if any of you know anyone in those states that you can reach out to who is a health professional or might be a climate activist that says, yes, I know a doctor in my group, I know a nurse or a respiratory therapist, please, please, please. That will help us get more publicity. So next steps, we're going to hand deliver the letter to Feinstein and Padilla's office on Wednesday, August 18th. Why is this important? Because the filibuster is blocking a lot of climate action. And in fact, just this morning, they held a vote about the S1, which is the democracy reform, and two other more limited bills, and each one of them was filibustered. And Feinstein has waffled on whether she would support modifying the filibuster. So we need to continue to pressure her. Next, please. So now I'm going to turn this over, momentarily, we're going to talk about civic health, and I'm going to turn this over to Margie.
Thank you. Hey, did you know that August is Civic Health Month? And why do we care? Next slide, please. We believe that all Americans should be represented when shaping health policy because it affects our health. Next slide. And we docs and health professionals owe it to our patients to be at the table when it comes to deciding our nation's health policies. Next slide. How do we docs do when it comes to voting? Well, there was a paper that was published and it showed that from 1996 to 2002, eligible physicians voted approximately 9% points less than the general population. That's like appalling. Well, have we gotten any better? Next slide, please. Next slide, thank you. Well, a follow-up paper showed 2006 to 2018, eligible physicians voted approximately 14% less than the general population. So we're doing worse. So next slide.
Ashley, can you launch this poll for us, please?
I can launch the poll.
Okay, Amanda, good. So we hope everyone will,
You guys see that?
Yes.
You all see it? Okay.
oh, I don't see it. Interesting. Okay.
There should be 3 questions.
Got him.
So I guess, Amanda, when you see that most people have answered, then you can release the results.
I can't see who has answered. Okay, let me play around.
Percentage of answers. I think. All right.
So
cool.
Oh, Ashley, so you can do it?
Ashley, on your end, do you see results?
Yeah, we're viewing the results right now.
Oh, okay.
Are you registered to vote? 100% said yes. Did you vote in the 2020 presidential election? 100% said yes. Did you vote in the last midterm or local election? 94% said yes.
Okay.
Good job, our friends.
Yay. Okay.
On the poll and the voting.
Next slide.
Yay. Okay.
Marky, you want to go back then?
Can you get the next slide, please?
This one?
Yeah. So for you, those of you who want to check your registration, here's the link to make sure that you are registered to vote, you have the right address, etc. But so here's the link, and we'll put it in the chat as well. Next slide, please. So Civic Health Month has 3 objectives: drive voter registration, increase awareness around upcoming elections, and amplify our civic voice in healthcare. So we just urge you to vote, to check your voting status. And Cynthia talked about how we're trying to amplify our voice in this about voting in our democracy and our health of our democracy. And then we're going to cover right now increasing awareness around upcoming elections. Now, does anybody want to volunteer their awareness of the next local election or state election? Do we have one coming up?
The recall.
Thank you. Okay, next slide, please. Next slide, please. Okay, so there's a election recall for Governor Newsom on September 14th. And why does this matter? Well, it's not him so much, but a Democratic governor will select a possible senator appointment because Feinstein is 88 and she may resign or get ill or something. And so we would be able to, the next governor is going to be able to select a senator. Obviously, our climate policies are dictated by our governor and COVID protocols, our health and safety of our citizens.
1 minute warning.
Okay, so what's on this ballot? It says there's 2 questions on this ballot. It's called recall Newsom, and you should vote hopefully no or yes. And then if you vote no, you do not have to go to the next question. The next question is select a replacement, and there are 46 candidates. And if he's voted out, then the person who gets the most votes in this 46 group will be the next governor. With very little plurality, we can have a new new governor. The leading candidate right now is Larry Elder, a talk show host. He's an anti-vaxxer, and he doesn't know if climate change is contributing to wildfires. So please tell your friends and family that we need to pay attention. The Democrat voters are not really galvanized about this election. They don't really know about it. So I think we need to inform all our friends and family that we have a election coming up and we need to vote. So that's what we have for you today.
Thank you. Really appreciate it. Maybe we have room for one question if there is one on voting.
I just want to make one statement, which I attended a democracy webinar last night, and they were saying the Newsom recall is essentially a coup where the weapon is money. One person has donated 7 million to this and is running himself. And it's just so important that we encourage people to vote right away. Everyone's going to get a mail-in ballot and just vote no, because this is a coup not a legitimate recall.
Mhm.
And there was a
Amanda?
question.
Oh,
Amanda?
I had a question for you all. How much is this I mean, I think for many of us, we feel like Newsom has not done so much that we have hoped and that he could. How much, but I you know, my limited understanding of all of this is that it's also a very slippery slope to use this as an opportunity to push him more. Do you all, from what you know, do you see this as an opportunity to say, like, Newsom, we will come out in support if you use your authority to demand CalGEM enact setback? Like, is it that sort of a situation, or is it just like, we need to just do everything we can to get him reelected so that we don't have a Republican governor?
Margie, you want to take that?
Yeah, I think it's the former. I think we have to just accept and then push him later, because
Okay.
if you vote yes, then he's replaced. He's out.
Yeah.
If the majority is we want the recall to go through, then the next step is a replacement. He doesn't get to run again. He doesn't get to be in that new pool of people running. So it's not like we can give him that feedback. So you just have to vote that we'll deal with him later.
And I agree. I wholeheartedly agree. And if the Dems were galvanized and everyone was going to turn out and it was a shoo-in, then we could use this to push. But most Dems think, oh, he is a shoo-in. We don't have to worry about this. These are all bozo candidates. Don't worry. It's not. We have to mobilize people to support him and then push.
Yeah. So I see Adrian put a question in about the helping our beleaguered healthcare workers to vote. So I believe we're going to talk about that next time, like the vote ER stuff.
Right.
Is that right? So if we could push that question, because that'll be the topic next month. It's a really important one. There's like lanyards you can put on your ID badge. But in the interest of time, is it okay if we turn our attention to the global?
Can I just make one comment? I serve on the
really short though.
I'm a delegate to the California Democratic Party, and all I can say is they are doing everything they can. You can phone bank for them, you can walk and drop literature for them, call all your friends and ask people to please vote no. This is a Republican coup.
Yeah, got it. Thank you.
Is there a link, Bonnie, that you can put in the chat that people could sign up to do that? Okay. Thanks.
Okay. So I think we're going to start with a video, I believe. So I'm going to turn it to Nathan Oaktman joining us from our central hub. And I know you want to show a video. Amanda, could you maybe show the video? Because
yes, I just need a link to the video.
It's in the slides.
Okay.
Does that help?
Yeah, it's going to take me a second to get the slides up. But yes.
So while she's doing that, Nathan, the floor is yours. Oh, the link is in the chat.
Yeah, so maybe Amanda, just let me know when you have it up. But the first slide, just for transparency purposes, lays out a few objectives of why I think this is a useful topic. And in summary, it's that local and global do not have a neat divide, and so much of what we're talking about locally and at the state and national levels are the same or very similar topics at the global level. And just a few months away, there's a big meeting coming up. So wanted to have that on our radar as much as possible. And this video gives a good introduction, hopefully whet everyone's appetite.
Here I can share it.
Cool. Let's go ahead and go to the video. Thanks.
Okay.
In November 2021, the world comes to Glasgow, our home city, as it hosts COP26. As a principal partner, we wanted to explain what COP, or as it is otherwise known, the Conference of the Parties, is, and why we are involved. In its simplest form, COP is an annual event where world leaders come together to agree a collective action plan and set targets that can be enforced fairly in the global fight against climate change. Back in 1995, the first COP was held in Berlin, and since then the urgency for action against climate change has grown in importance. During COP21, a milestone was achieved with 196 countries agreeing on an international treaty known as the Paris Agreement. Its goal is to keep global temperature rises to well below 2 degrees and pursue efforts to limit it to 1.5 degrees. Countries have yet to finalise the rules on how the Paris Agreement will operate going forward, and COP26 will allow countries to complete that job. COP26 will be the biggest summit the UK has ever held, with many describing it as the most significant climate change summit of all time. Supporting COP26 demonstrates that we are invested in the success of the conference and its outcomes, and our participation reinforces our...
Okay.
Yeah. Thank you. So if we could just go back to the slides. The IPCC report that Cynthia referred to that came out just 2 days ago is something which is very closely related to what's going to happen at COP, and it was described as Code Red for Humanity. So in the coming few minutes, I'll just give a general overview about some of the basics of the goals of COP26, and then also talk about some next steps where we can link up local efforts with what's happening at the global level. Next slide, please. So there are 5 themes and 4 goals, and currently there's no inclusion of health at this highest level yet, but there are key stakeholders and a push to try and ensure that health is integrated, if not at this COP, in the future. So the 5 themes touch on clean energy, clean transport, climate resilience, nature-based solutions, and climate finance, with the goals being mitigation, adaptation, finance, and collaboration. Next slide, please. So as part of the preparations for doing this presentation, I tried to see California-based organizations or people within our broader network who are leading some of the efforts to integrate health at the highest level, and found that the Global Climate and Health Alliance is helping to organize a global conference on health and climate change together with other high-level partners. They're also developing a scorecard for the nationally determined contributions, and we have one for the United States that's quite interesting to see what we're doing well and not so well. And then also Healthcare Without Harm is working together with the WHO and the UN Climate Change Conference as the listed organizations for the COP26 and health program. So I've done some outreach and am hoping to get some responses to try and see about ways that we can build on efforts that are already ongoing, to see ways that we can raise our voices and help to advocate for appropriate and urgent action. Next slide, please. So I just have a few potential next steps listed here. If anyone is interested, we have 2 weeks, August 25th deadline for a special report for the health argument for climate action. So the link is included in the document that's all referenced in the last slide. There's some community activities, including UK health professionals that are doing a cross-country bike ride, talking some about the possibility of doing a film screening for a case where youth in the United States are suing the US government, and the documentary is called Youth v. Gov, and would be happy to be in touch if anyone has ideas about other opportunities that we can do things in California or in our region that can raise awareness about COP and be sure that everyone is familiar with what's going on. Mention about the couple of conferences. There's a Global Climate and Health Alliance info list where you can stay up to date on these activities. A few webinars, including one in September that I will moderate that touches on the impact of climate change on children, and we're going to focus specifically on COP26 and mobilizing around it. Then the Global Climate and Health Alliance has webinars every 2 weeks on Thursdays, including one tomorrow that touches on COP26. And then you can sign up for weekly updates, and there's a New York Times hub that focuses on the COP. Next slide, please. So as mentioned, there is the link to the document, and I have the information that was just touched on go into more detail with some additional resources. And I would appreciate if anyone shares an interest in this, if you can send me a message and we can see about ways that we can link up and raise our voices together. And hopefully we have at least a little time in case anyone has questions or discussion about any of the global COP related topics. Thank you.
Yeah, we definitely have a couple minutes for questions. I really appreciate you putting this together, Nathan. It's too bad Robin had to drop off, but. Well, I would definitely love.
Karina. Oh, Karina has a question.
Yeah, I just wanted to say what Robin said, because she told us at the beginning that she had to leave for another meeting, and she wanted to stress how important it is that we try and contribute and influence COP26, and how Biden, if you know, you probably have received emails from your other organizations about the clean energy standard and the renewable energy.
Karina, you muted. You're muted.
Oh,
now you're unmuted.
The whole time?
No, we heard you about Biden and then it cut off.
That's weird. I don't know how that happened. Sorry. So if Biden doesn't have the backing of the US in terms of, you know, something that we are working towards for the US, the clean energy standard, the renewable energy standard, then COP26 will not be as much of a success. So Robin just wanted to emphasize how important it is.
Amanda, do you have your hand
raised?
Too?
I do, but if somebody else does, they can go. I don't know. No. My quick question, Nathan, for you or anyone who knows the answer to this, for the giving feedback on the special report, is that something that is being done just by individuals, or are organizations supposed to submit comments? Do you know?
I think there's probably an option for both.
Okay.
The organization is generally a more difficult barrier to achieve, but I think if Climate Health Now would want to review the documents and think about ways that we can give feedback, that would certainly carry a greater voice than us individually.
Just as individuals, okay.
Yeah.
Yeah, I love just thinking out loud, Nathan, about maybe the film screening as a lead up to the ISOP webinar, just to plant that seed. Wonderful. Well, thank you. I so appreciate that you brought this up as something to discuss, because it does seem too big to me. So I haven't engaged with it at all, and I can see the value. Margie, did you want to add something before we move on?
Thank you. So, you know, part one of the infrastructure bill passed. That's more about bridges and roads. But the part two, which is more about social policies and social infrastructure, and it's all about the climate stuff. All that money is in the second bill. So we really need to pay attention to passing part two. And there's actually a meeting tomorrow with Pelosi staff about talking to her about what we would like to see happen with the infrastructure bill part two, and what are our demands and priorities for that part two. Because I don't think the Democrats are all together about part two.
Right. Yeah, and there's definitely a lot of synergy between the COP goals, what we bring in, and probably the second package. So awesome. Well, thank you so much, Nathan. And is it okay we kind of informally call you our COP lead for CHN?
Yeah, be happy.
Wonderful. Okay, yeah. Thanks again. And Nathan's one of our 24 members doing the CHN Catalyst Collective too, so you'll hear more from him. So the bill that CHN is co-sponsoring in the California legislature, it's made it from the Assembly, now it's in the House, now it's in the Senate, and it's probably facing its hardest challenge, which is the Senate Appropriations Committee later this month. So the bill's goal is to require the California Air Resource Board, which is the agency charged with kind of meeting our state's GHG reduction goals through a suite of policies across the economy, really all sectors. But they don't evaluate the health impacts of the different climate policies. So this would require them by law. They've been encouraged internally to do that, but this would require them by law to evaluate, to do a comprehensive health analysis of the CARB scoping plan. So the committee that it's going to be heard on to see if it's worth investing in, which I want to say it was like the fiscal note was about $1 million to do this health analysis. I'm not totally sure on the, I can't remember the amount, but it's an investment that we have to kind of, you know, fight for this being worth the investment. And so we have one connection through Senator Portantino's office. So that I think we're good. But if anybody is in Senator Bradford's district, which is kind of one of the many senators in the LA area, we're also looking for connections to Senator Kamlager, who's in LA, also Culver City, Westmont. And then I think, actually, Nathan, you're in Senator Laird's office, and so is David Bezant. And so maybe we could work on a meeting. What the request is to, we need constituents to reach out to each of these 5 senators to ask for meetings so that we can, you know, inform them about the bill and why we as health professionals are advocating for it. So the last one is Senator Bob Wojciechowski in the Hayward, Fremont, Santa Clara area. So if you are in, is anybody in any of these districts, right?
Susan, are you in one of these? Bradford or Kamlager? Maybe you're related. No, Bradshaw and Bradford.
That'd be amazing.
Those names don't sound familiar.
Yeah.
I would have to look it up.
Yeah.
Yeah,
that'd be great. We can follow up offline.
Is my Senator Sidney?
Oh, your audio is not coming through very clearly. I think you said Senator Sidney Kamlager, but Susan, I can follow up with you about.
Hello?
Yeah, we can hear you now. Susan. I think there's some audio.
Oh, yes. Yeah, there's audio problems, but Senator Sidney, that's who serves as our senator.
Okay, wonderful. Awesome. Well, I'll follow up with you. That would be really helpful if we can schedule a meeting with Kamlager's office. Is anybody in Bradford's or Wojciechowski's? Okay. All right. Well, Susan, I'm going to be calling you.
Okay.
Awesome.
Yeah.
So then, thank you for speaking up. And then I'm going to hand it over to Jeff and Karina to share some updates on the sustainable energy team.
Thank you. I am the timekeeper, and I give myself 1 minute, but just super briefly, just as an update, what the sustainable energy team has been up to. We are still following along. CalGEM has yet to release the public health rules. Vision Coalition is the big group leading that. They've met with CalGEM twice, and we're waiting to see what the update is on their last meeting. The legislative session's coming to an end, but we've been working on several bills. We had a guest speaker at our meeting 2 days ago, Dr. Carol Weed. So she spoke to the legislative process. We recorded it. I'm going to post it on Slack. But it was super helpful for me just to start to understand better how things work, because it really can be dizzying in the mind how our democracy works or doesn't work. And we had her speak because we want to be more equipped to tackle 2022, the legislative session, and potentially influence what bills might come up or not. So that is sort of what we're working on this summer and fall. And then Jeff, I don't know if you want to mention the talk September 12th. It's by Dr. Kamen, who is director of the Renewable and Appropriate Energy Lab at UC Berkeley, and he's a coordinating lead author for the UN IPCC. So the sixth report that just came out, he is one of the main people. So Jeff, did you want to do a pitch for that?
Sure, I think this will be a really interesting talk. He's on the cutting edge of climate research. He recently came out with a study co-authored by Leah Stokes, Tom Steyer, that we need to become net carbon negative by 2030. He shows us how we can do it in California. He encourages California to be the leader and not the follower. And he just came out with an opinion piece in the San Francisco Chronicle that you should look at. It's very interesting. And at the very end, he says, he asked us to rise up and demand action. So he wants to partner with us and get more people involved. And his wife is a doctor, and we have to get her involved in our group too. And he's
right. And his talk is called Accelerating the Timeline for Climate Action in California.
Yeah, it will be really, really good.
And then our next meeting is Monday, September 13th. That is it. Thank you.
Wonderful. Yeah. Thank you for that. Yeah, we'll definitely include the September 12th talk in our newsletter. So now we're going to wrap up with announcements. Thank you, everybody. This was a very highly technical dance to kind of make so many things, bring them into this hour and a half. So I appreciate everybody's collaborating. So Cynthia, do you want to share this opportunity with Last Chance Alliance?
Sure. So the Last Chance Alliance, which is 70 plus organizations throughout California working to stop oil extraction and setback, it has a media campaign focused mostly around the wildfires to make the connection between extreme events and climate change. And so they're looking for quotes and stories about that connection. And if anyone has a health angle story or quote, just contact me and I can put you in touch with the communication team there.
Great. And then this, so Ode, are you on?
Yes, I am.
Great. Do you want to share about next Tuesday?
Yes.
Next Tuesday.
Yeah, it's like, hi everyone, I'm Ode. I'm third year medical student at UCSF and also at PSR. And yeah, just recently partnered up with Amanda to put together a solidarity action, seeing a solidarity of Indigenous and frontline activists in Minnesota sitting against the Line 3 pipeline expansion. And so we'll be meeting on Tuesday, next Tuesday on the 17th at 2 p.m. in San Francisco in front of the Army Corps of Engineers office and presenting them a letter to Joe Biden. And so we're planning this in conjunction with SFPSR and a number of other advocacy groups, and are hoping to have a solid presence of folks in their white coats. So yeah, please join us. We'll be circulating around a sign-up sheet and more information this afternoon.
Yeah, wonderful. And our resident artist, maybe you could say, David Solnit, he's working on a large scale like prescription pad banner that we're going to say, diagnosis, Line 3 health threats, and the cure is that we revoke their permit. So something in a prescription pad that will be very visual in terms of what our message is as health professionals, calling to stop building this tar sands pipeline and all fossil fuel infrastructure. So next Tuesday at 2, San Francisco, and we'll send a flyer soon. And then I wanted to share this. So the Columbia hosts the Global Consortium on Climate and Health Education, and they are offering a webinar Thursday, August 26th about heat waves in the Pacific Northwest. And they'll have clinicians and health experts talking about this, new pattern that we're going to see more of. So if you want to join that, we can share the invite with you. And then many of our Climate Health Now members are also collaborating on the NorCal Symposium for Climate and Health and Equity. And it's going to be Friday, September 24th, so a little over a month away, from 12 to 7 p.m. And the last I heard, it was going to be mostly virtual. And I don't know if Jonathan's still on, but I think it's going to be all virtual now. So it's focus on sustainable healthcare, food systems, medical and community education, air pollution, and wildfires.
That's true. I'm an advisor for the food group, and I think we did decide to make it all virtual, but
yeah. So it's a wonderful, wonderful way to meet other, allies and colleagues across the Northern California. And if Karina's involved, there's Southern California input too, which is great. So a really, really wonderful event. Couldn't more strongly encourage you to attend. And I forget who it is, but who is known as the founder of the environmental justice movement. I forget his name in this moment, but he's the keynote. Yeah, exactly. Thank you. You nailed it. Last year it was Gina McCarthy. So I would definitely save this date and register. And I think if you take a picture of this QR code, you will be brought to where you can register.
And Ode is one of the organizers.
Oh yeah,
one of the student organizers.
Yeah,
and Lisa Patel, who's not present but is part of CHN and many other groups, is also one of the main organizers.
Yeah. So it's in the family. Definitely want to. I would encourage everybody to attend. And a shout out to some cool podcasts. So the secretary of the California EPA, Jared Blumenfeld, he has a podcast called Podship Earth, if you haven't heard of it, that talks a lot about climate resilience here in California. I have a fun podcast where I interview colleagues basically about why they care about climate and what they're doing. Our last episode was about interviewing Dr. Sherry Weezer from the UC Climate and Health Center. And then there's also one that I just found called Everybody Now, and it's the host of it is the Extinction Rebellion co-founder Gail Bradbrook. So if you're looking for some cool podcasts, wanted to put those out there. And then when you're talking about Climate Health Now to your friends, being sure to always invite them to join us, because our vision is that every health professional in California is, if not a member of CHN, a member of some group and a member of, a participant in the climate movement in a way that really leverages our unique voice, as Supervisor Chavez mentioned, our unique voice, our unique credibility to, bolster the public will for the climate action we need to protect everyone we love. So how new members join is they email us at caclimatehealthnow@gmail.com. You can CC them and introduce them. We just need their name, what their day job is, where they live, and ideally their phone number. And then that will bring it into our amazing onboarding team, which includes Dr. Margie Chen. And then our next meeting is September 8th, and we'll swing back to the lunchtime hour for those who can't do the morning. And that is it. We made it with a minute to spare. Any comments or additions, questions?
Can I take a screenshot of everyone? Can anyone who's able to come on camera, can you come on?
Oh yeah, and it'd be fun, Amanda Foote, if you want to introduce yourself, and also Reshma, is that how you say it? Yeah, we can take a picture and then it'd be great to have you introduce
yourself. I'll do on 3. 1,
2, 3.
Awesome, thank you.
Hey. Yeah, is it Reshma? Is that how you say it?
It's Reshma. I'm sorry, I was juggling getting out of jury duty this morning and then being on the call. So that's where I was sort of semi-absent. I'm so glad to be Karina sort of introduced me to the group, and I'm really excited to be here. I'm a pediatrician, not clinically active, and my real passion and area of interest has been plant-based nutrition. So
wonderful. You have allies here. Yeah, definitely stay. Yeah, I got your email, and we'd love to have you participate more, and we're glad you're here. And then Nightingale, would you want to say hi? I don't think you've said hi at a community meeting before, if you're able to come on. Maybe she's off. Oh, there.
I'm here, but I'm driving actually. So Nightingale, I'm currently in Illinois, but more or less going to be based in Salinas area. I'm a registered nurse and very interested in working anything around children and the environment and climate. So I'm very happy to be here.
Awesome. And another one of our Catalyst Collective participants, Really excited to work with you more. And let's see. Yeah.
Is Amanda
Oh, yeah.
still on? Amanda, are you the other Amanda? No, I think she's off.
Yeah, she dropped off.
I don't see her.
It's funny. Introductions at the end. Wonderful to be with you. And I always appreciate these meetings. It feels good to be with colleagues and community who shares concerns and action. So glad you're here. We will be in touch with a jam-packed, highly nutritious newsletter. And hope you all have a great Wednesday. Okay, bye.
Bye, everybody.
Bye. Thank you.
Thank you, guys.